Hi, everyone. Nancy Forrester here, Executive Director of the National EFT Training Institute in Canada, and happy to be doing a second interview with Dr. Bob Schwarz, who's a licensed psychologist in the States, and he's Executive Director of ACEP, the Association for Comprehensive Energy Psychology. And Bob's written a couple of books on trauma, and I asked him if he would just speak to us about how EFT fits into a phase model of trauma. So thanks, Bob, and I'm handing it over to you.
Well, it's a pleasure to be here. Okay, so just in case people don't know, the idea of when I teach workshops, I usually say, how many of you do how many people in this workshop do phase-oriented treatment? If you do that, raise your hand. And unfortunately, most people don't raise their hand. Yeah. And then I say to them, uh-oh, you guys are all unethical. They go, oh no. And I said, don't worry about it, we're gonna fix that. And then I explained, the phase-oriented treatment. And most people actually, once they realize that, they do know, they know about it. But this originally comes from Judy Horman's work. And the reason it's important is it really is the standard of care in trauma treatment. Yeah. So phase one basically is stop the bleeding, stabilize the client, stabilize the patient. So stop the bleeding. In the ER, that's what you want to do. Yeah. Phase two is the operating room. If you're in a medical model, it's working with traumatic memories. Yep. And then phase three is really helping reintegrate the person to, that worked into their social lives, into their lives. And I also think about it as integrating with themselves. Right. So it's an integration piece. Yeah. Mm-hmm. And the other thing to know about phase-oriented treatment is, that when it's not really linear. And it's, in any given session, you could be in all three phases at any given time. You can go with phase one, phase two, you're back to phase one. And so on. And you don't have to even do it in order, depending on what's going on. What's important as a trauma-informed therapist is that you have some sense of where you are. Right. And the rule of thumb is, when in doubt, don't do phase two. Yes. And there's a long history of this that goes back to, back in the day with the so-called false memory syndrome, which is not really true, but that's another story. When people were basically doing too much trauma too fast and people were kind of getting hurt. Right. So phase one is stabilization. So in phase one, the goal really is to down-regulate the client so that they are relatively safe. Right. And as a rule, EFT is either usually used in phase one or phase two. Not used as much in phase three, although there are ways to do it. But yeah. So in phase one, what you're generally going to do is you're just doing what I would call palliative care. You're just tapping to get the number down, for starters. Right. Or you're doing, just to calm them down. You're not going to focus on a specific event, for instance. Another way you could think about it is, again, something like tearless trauma technique is sort of phase 1.5, because you're starting to focus on something, but you're doing it in a way that keeps it over there. So, mm-hmm. So the trick is you really want to keep the person in what's called a window of tolerance. You don't want them too hot. So phase one is you're just calming them down. You're doing generalized tapping just to get them. So what number are you? I'm a 9. Okay, well, let's just see if we can tap. Even though I'm a 9, even though I have this feeling, even though I have this anxiety, I deeply this thing, and you're not focusing on memories as a rule. Right. Right. Mm-hmm. It could be an addictive urge, whatever it happens to be. Yeah. But you're doing it to, instead of deep. So
we're staying pretty global with the tapping. Then we're not going into
staying global, but in the sense that you're not doing global thinking about globally about a traumatic event, because that could cause trouble, right? So it's just global in the moment, symptom reduction in the moment. I have this ache or pain in the moment. Right. Whatever it is in the moment.
Beautiful.
And the goal isn't to get them to 0, because that's not likely to happen. The goal is to get them secure enough so that either they can walk out of your office because you don't have time, or you could then do phase 2 work.
Right. Right.
So, for instance, in our other conversation, when I was told this story about the woman who said that she walked in on where her child had killed herself, and that just impact, and she would just lose it instantly. It would pop up. She'd instantly go to a 10. It was really important to do some kind of phase 1 work so that she wouldn't go right to a 10, which would give her some mastery, some control. And by the way, sometimes it's not just EFT, you're integrating it with some education, you're explaining things about how trauma works. It's not just EFT, but the goal is normalize, contain. Because the problem is the person is spinning out of control, and doing more trauma work is generally not the way to go.
Right.
Now, there is an exception to that.
Okay. The
exception is somebody walks into your office, they're in the middle of I don't know, like you work in an emergency room or something, and the person is like just smack dab in the middle of a traumatic event. I mean, they're just in it. So in that case, you actually can just start to go through the procedure, which is sort of like a phase 2 procedure, but the goal is to calm them down.
Yeah, exactly.
They're just so overwhelmed, right?
Yeah.
So that's a pretty much more advanced, but it's a way of thinking about it. I'm still trying. I'm not going to clean everything up. The strategic goal is to downregulate the system.
Right.
And,
Right. Downregulate around that specific trauma.
Around that, whatever's going on in them, because they're just way too hot and they can't process.
Exactly. Yeah.
And so then you go into, if we talk about phase 2 work, that would be where you would work on a specific event, and that's where tell the story is, the king or queen of the day, and even that, and this is where for people that know. So I don't know how many people are watching this know EFT. Some might not. So telling your story in trauma, that's tell the story, right?
Right.
No, not right. I mean, that's the problem a lot of the time. A lot of times people tell the story, or they just talk about the story, and they just get flooded, and they react.
Yeah.
So, and they just get re-traumatized.
Right.
So that's actually anti-therapeutic. And I get into my, like prolonged exposure, like as a, where you just flood the person and force them into, I just think is barbaric.
Yeah.
And it doesn't work as well as EFT, the research indicates.
Right.
So we don't want the person to be flooded. So even then, even in tell the story, which is phase 2 work, we're still going, yes, but I don't want this person overwhelmed.
Right.
I want this person calm. I want them, not calm. I want them not blown out.
Yes.
Right? And that's where, in tell the story, what we do is the instruction for those that don't know is you have the person tell a bit of the story, but as soon as they begin to get upset, they're to let you know, or if you see it. We don't want them kind of, freaking out as they go through the story. So they get 30 seconds into this small little story, and they're 5. Okay, stop right there, and you start to tap right on that thing until that comes down. Right?
Yeah, so that's the actual place where the disturbance is living in the body and the brain.
So it's like, if we're gonna use an analogy, you don't do brain surgery by just kind of cutting everywhere. We don't take out the whole brain and go, I don't know. You work a little bit here, you work on one little vein or whatever it is, and you fix that little thing, or for that matter, and then you move on. You don't just try to do it all at once. Right? And so that's the beauty of this particular approach is you work one little bit, the person comes down, then you move on to the next crescendo, then you do the tapping on that crescendo, then it comes down, and you go all the way through as long as it takes. So even though it could be a 3-minute event, it could take you conceivably an entire session.
Yes.
Really go through it. And then you again, cycle back, you test the work to make sure it's all cleaned up. So that's another great, EFT thing of when you test the work,
Right.
you go back, you have them, is there any reaction? So, and if there is, that's not a problem.
Right.
It's just great. Oh, we found some more. It's like, okay, well, I missed that part. So we're going to get that out. So that there's a sort of, there's no ego involved. So that therapist can't have an ego that says, I got that trauma done in,
Yeah. Exactly.
And not to worry, it's pretty quick, but it takes whatever it takes, and you're just with the client. So that would be really good phase 2 work. And then if we're just gonna, and then this sort of gets into, there's this interesting question about, well, okay, so you did this tapping, and yes, you got the person's trauma down to a 0. Why does it stay a 0?
Right.
I mean, why doesn't it pop up back to a 10 tomorrow or the next day? How does that work?
Now, what actually changed?
Right. And so the answer that we talk about these days, I talk about these days, is it's memory reconsolidation.
Yeah.
And because what's going on is that you, by going through this story very slowly, you're going through it repeated times, and you're getting through every single way that it's the body, it's a 0. You're 0, 0, 0, 0, 0, 0. So you're disconfirming, you're changing the experience. So one of the things I often ask people is, and if you're listening to this, like the question is, how do you know if a trauma is completely worked? I mean, completely metabolized. How would you know? What's the measure? And the answer is when you think about the event, your body stays totally relaxed. You feel totally safe.
Totally. Yeah. You've got a calm nervous system.
Right. You're full in the face of it.
Yep.
And your system is. That's when you know.
Yeah.
And so, which gets into some other ideas about polyvagal theory, but that's the point. By going through it slowly like this, and making sure the body is calm all the way, and not toughing it out. Because if you tough it out and tell the story again and again, all you're doing is just kind of running the system, saying, "Okay, be traumatized, be traumatized, be traumatized."
Yeah, exactly.
Lousy neuroscience for that.
Yeah.
So that's phase 1. That's phase 2.
Yeah.
And
so then how does this move into the phase 3, the reintegration piece?
So, well, that's where it gets interesting. So, and again, I mentioned in the other video that I know a lot of narrative therapists up in Canada. I've been training up there, and so what usually happens when you do this kind of work with people, and you ask them about the event, and they will tend to spontaneously bring up new information. They will spontaneously reinterpret this. The experience will not mean the same thing anymore.
Right. Right.
They won't feel like a victim. They'll have recovered a memory that they've forgotten about, a piece that they didn't remember. And so in phase 3, you can just interview them about what does that mean to you. That's when you might do some of your narrative work or cognitive reframing, or just say, well, what does that tell you about yourself now that you didn't know otherwise?
Right.
Or questions like that.
Yeah.
And if you wanted to, EFT doesn't, as a standard EFT, doesn't do a whole lot of building in states as a rule. But there are like other approaches in energy psychology, and some people kind of then take EFT and shift it around, and they make it more, I don't know what you call it, but they're using tapping. You could say, oh, so now I think, now I used to think I was this way. Now I think I realize that actually I was pretty brave to do that.
Right.
So you could go, does that, like in EMDR, you might say, well, how much do you believe that?
Right.
And you go, on a scale of 0 to 7, I believe it kind of a 5. Would you like to believe more? Yeah. So even though I believe only a 5, that I was more heroic than I thought, I deep think completely love it. 7. yeah, I was more heroic. I did do that. I did stand up for myself. Yeah, I am a pretty cool person. And, it's like I can choose to see myself, even though that happened, as a heroic. So you could build sort of a tapping assisted narrative retraining.
Yeah. And then a question around what's possible for that person now.
Right.
That would not have been possible before.
Right. And then another thing might be, okay, so, or what new challenge, okay, now that you know that, what is it that because now I have to do this in my life. I've always thought I couldn't do X. Now I'm going to do X. Okay, well, what do you think about that? So think about doing X, whatever that is. How does that feel? It feels a lot better, but I still feel a little anxious. Well, then you can tap on this new thing. So you're just sort of, that becomes a new problem, but you're sort of sequencing it so that, again, it's moving all the way through.
Exactly. Really into the new behavioral piece.
Right. Even though this feels weird, even though I'm not used to it, even though this is not the way I usually think of myself. Those kinds of things. Yeah.
Well, it's really the post-traumatic growth piece that we talk about, right?
Right. Yeah. But frankly, generally, I find that most people have this pre-spontaneous stuff, and I don't really even need to tap. You can, that's fine. Just having this real, honest, sort of heartfelt conversation with them. Wow, that must be really different for you, And then you can ask questions like, so what do you think? Do you think that now that would you tell your child that? Would you tell your wife that? How would you talk about this to other people now that? And so you're beginning to bring this social thing, and how does that influence how you might think about yourself in the next time? They go, oh yeah, I guess I could think this way.
Yeah, beautiful.
And so you're just building these connections in this new way, and whether you tap on it or not is interesting. I don't know.
Yeah, so you're really facilitating that new flow of information, and helping them to practice that, reinforce that.
Yeah.
So, final statement here about how you see EFT being so helpful in the.
Well, like you, I'll say this. They said we think this is a pretty cool tool, and so just if anyone wants to see another, we have a three series thing. I think it's called the website is what is it? free-EFTcourse.org. So it's a free-EFTcourse.org, and there's it's a 3 20-minute videos of me talking about the neuroscience, the research, and then some of this stuff.
Yeah.
But the point is that what I like to see is more mainstream folks using this stuff. It's a great tool, and I usually tell people, look, especially with trauma. But we also talk about, this is relevant. We also talk about, and I know you know about this too. The ACEP, the adverse childhood events studies. And so there's all this research that shows that early childhood events lead to heart disease and all kinds of other stuff. And so my fantasy, what I want to see, and here's the thing about the ACEP study, because the only problem with the ACEP study is they show this connection, but they don't really say how to fix the problem.
Exactly.
Right? Well, I think I know how to fix the problem. And I think you do too. So imagine this. You go into a physician's office, and they give, as part of you get an ACES, you get 10 questions, and the person scores a 6 on the ACES study. And then the physician says, wow, you've got a 6, this leads to all kinds of problems, yada, yada, yada. And oh, by the way, we've got I could refer you to someone who does EFT or some other energy psychology technique that you could work on, that not only will it help prevent heart disease and all this other stuff 20 years into your future, but you'll feel better right here and now after a few sessions. Would you would you like that? And I'd like to see that, that's standard.
Yeah, absolutely.
And my fantasy is I want to see this study done, and we'll see, let it run for 10 years, and we'll see, especially if you get people in their teenage years, the drops in addiction rates, the drops in heart disease, all these things, because it's all based on these adverse events. Trauma happens all the time.
Absolutely. And we, as you say, we understand now the size of the impact of childhood trauma in ways that we didn't understand even years ago. But the big question is that what are we going to do about it now? It's not enough to just.
It costs. There was a study done in the United States. The CDC estimated that 1 year's worth of child maltreatment, which would certainly leads to, I think it was a lifetime cost of $150 billion. A lot of health. That's 1 year's worth. Yeah. 1 year's worth. 10 years worth is $1.5 trillion.
Mm-hmm. Mm-hmm.
We're talking a boatload of money.
Absolutely.
That would, and I'm not even talking about, a better life. Just the money alone.
Bottom line, exactly.
Would make a huge difference in lost wages, productivity, health, yada yada yada.
Yeah.
So that's why I think this stuff is, more people ought to know about it. And as you and I both know, there's a ton of research these days that really show it works. This isn't just you and I, a couple of excited people talking about it. There's a lot of research. There's over 85 studies these days and 49 RCTs. And
yeah, absolutely. That question is not the central question anymore about is there research to support this? And really, it's the reason why I'm so appreciative of you taking your time and coming on this EFT Untapped conversational series. Because now we need to hear the voices of the people who've been doing this a while and who've seen what the results are, and that we actually have ways to resolve these challenges.
Some people still need that, because yes, we believe it, but there is still a whole bunch of folks who don't know that research and need to know that it's out there and need to know that it does, so, but yeah, you're right, I agree with you.
Yeah, it's there. Well, thank you again, Bob. I just appreciate your expertise and your history and everything you're bringing to this. So
thanks so much.
Thank you so much.
Thanks. Bye.
Bye, everyone.